A stroke is a medical emergency that occurs when blood flow to the brain is disrupted, either due to a blockage in an artery, ischemic stroke, or bleeding within the brain, hemorrhagic stroke. Recognizing the early warning signs of a stroke is crucial for seeking immediate medical attention, as prompt treatment can significantly improve the chances of recovery. Here, we will describe 15 early warning signs of a stroke in detail. Sudden numbness or weakness. One of the most common signs of a stroke is sudden numbness or weakness, particularly on one side of the face, arm, or leg. This symptom is often described as a feeling of tingling or a pins and needles sensation. It may affect the entire limb or only specific parts of it. In some cases, weakness or numbness can occur on both sides of the body. Confusion or trouble speaking. A stroke can disrupt normal brain function, leading to confusion, difficulty finding words, or slurred speech. People experiencing a stroke may struggle to articulate their thoughts or have trouble understanding what others are saying. Severe headache. A sudden and severe headache, often described as the worst headache of one's life, can be a warning sign of a stroke. The headache may come on suddenly without any apparent cause and can be accompanied by other symptoms. Trouble with vision. Vision problems can occur during a stroke, including blurred or double vision. Some individuals may experience a sudden loss of vision in one or both eyes. These visual disturbances are typically unrelated to any previous eye conditions and can be a cause for concern. Dizziness or loss of balance. Feeling dizzy, lightheaded, or experiencing a sudden loss of balance or coordination can be indicative of a stroke. This symptom may be accompanied by difficulty walking or a feeling of unsteadiness. Facial drooping. Facial drooping or weakness on one side of the face is a classic sign of a stroke. When a person experiencing a stroke tries to smile, one side of the face may droop or appear uneven compared to the other side. Nausea or vomiting. Nausea, vomiting, or a general feeling of sickness can occur during a stroke. These symptoms may arise suddenly and be accompanied by other warning signs. Difficulty swallowing. Sudden difficulty swallowing, accompanied by drooling or a feeling of food getting stuck in the throat, can be a warning sign of a stroke. This symptom is known as dysphagia and can pose a risk of aspiration, inhaling food or liquid into the lungs. Arm or leg weakness. Sudden weakness, numbness, or paralysis in the arms or legs, particularly on one side of the body, is a significant early warning sign of a stroke. It may make it difficult to lift or control the affected limb. Trouble understanding. Stroke can impair a person's ability to understand spoken or written language. They may have difficulty following conversations, comprehending instructions, or reading and writing effectively. Trouble with coordination. Lack of coordination, trouble walking, or a sudden loss of balance can indicate a stroke. Individuals may find it challenging to perform tasks that require fine motor skills, such as buttoning a shirt or tying shoelaces. Changes in personality or behavior. A stroke can sometimes cause sudden changes in a person's behavior, mood, or personality. They may become irritable, withdrawn, or experience uncharacteristic emotional outbursts. Fatigue or weakness. Feeling excessively tired or weak, even without physical exertion, can be a symptom of a stroke. This fatigue may be sudden and overwhelming, affecting daily activities and stamina. Chest pain or palpitations. Although less common, chest pain or an irregular heartbeat may be a warning sign of a stroke, particularly in women. It is important to note that chest pain can also be a symptom of other serious conditions, such as a heart attack, and requires immediate medical attention. Breathing difficulties. Labored or irregular breathing patterns, such as shortness of breath or gasping for air, can occur during a stroke. These breathing difficulties may be accompanied by other stroke symptoms. It is crucial to remember that these symptoms can vary from person to person, and not all may be present during a stroke. Additionally, some of these warning signs may be transient or resolve on their own, but it is still essential to seek medical attention if they occur. Time is of the essence when it comes to stroke treatment, as early intervention can prevent further damage to the brain and improve outcomes. If you or someone around you experiences any of these signs, do not hesitate to call emergency services immediately.